to Lucile Packard because I was experiencing for a long time severe pelvic pain, and I had been turned away by many doctors and I really needed some relief. So my parents looked up all the best places to come, and Lucile Packard definitely stood out. When I got here, I was referred to a pain team, and through several diagnostic tests, different things, I was referred to Dr. Kennedy, which was seriously the greatest thing that could have happened.
Kalmia was a challenging case referred to us through the pain service, where she was being managed for a chronic condition with pelvic pain. Initially, her bladder did not work well, but as the therapy progressed, we needed to deal with an overactive bladder. She initially failed some of the routine therapies, which are medication related because of side effects, and at that point we needed to think outside the box for a novel strategy and decided to go with a bladder pacemaker for Kalmia.
He took her through some really pretty awful tests, and he was just amazing with her. And then he started talking about putting in her neurostimulator and explained everything to me. And that was one thing that really impressed me, was he explained everything in terms that I could understand and relate to my husband. And it was just fabulous. And he is really a remarkable man, and not only in his knowledge, but how he interacts with families and with his patients.
Well, the bladder pacemaker is something that's not FDA approved for use in children, although in some limited clinical trials here in the United States and also in Europe, people have been using it in a pediatric population. Kalmia represented our investigational use of the device, and her conditions were well suited for using the bladder pacemaker, and we were quite fortunate that we were able to hit a home run in her therapy using it.
Before I even came here or saw Dr. Kennedy, I hadn't been to school for a very long time, and now I just completed my freshman year in high school, and I finished with a 4.0, and there's so much has changed, and it's been phenomenal. I couldn't have asked for better treatment, especially from Dr. Kennedy.